Okay, so let's look at the documentation sheet, okay? On the first, you're going to see that the patient's name, date of birth, approximate age. If this patient comes to the emergency department and it's a John Doe, then all you have is John Doe. You don't have age, you don't have date of birth, you don't have any of that. Then we need to know, historian, who's telling us the story, the patient, the paramedics, the family, or the nurse. Now, if this patient that we have from Mock Code is already in bed, then this really doesn't apply to us, and that's perfectly okay. What we do need to know is if there is an arrest, what time it was, what time CPR was started, and what happened. Was it a respiratory, a cardiac, or something else happened? When you place the patient on the monitor, or the patient was on the monitor when it happened, what was the rhythm and what started all this? You're then going to know what time the doctor came, and because usually this is the emergency department physician or hospitalist, and then who the primary care doctor is and have they been informed. This usually gets filled out at the end of the code after everybody's been there and filed through, and it has who the doctor, respiratory, nursing supervisor, the other nurses. This is important too. This is for the recorder. Whoever's filling this piece of paper out has to put down the time on whatever watch they're using and the time on the defibrillator, because sometimes they're off by a couple minutes, and that's really important, especially if the code doesn't go well or it does go well, or something happens that there's a question of how long did it take in between this and that. If there's a discrepancy and the recorder is using two different methods to tell time, the monitor and the clock on the wall, then that is going to make a big difference in what time things actually occurred. So whatever the person who records uses to record time needs to be the same thing. So if they use a wall clock, then they need to use a wall clock. If they use their watch, then they need to use their watch. Okay. So moving down, we see that there's IV, time, gauge, site, and initials. This is if you have to start it. If it's already started, you can just put IV present. Then we're looking at respiratory management. Is there an airway? Were they intubated? Was placement confirmed? If it was confirmed, we need to confirmed by CO2 and X-ray. We also need to know what size the tube was, what time it was intubated, what the number is at the lip line, and make sure that it was secured with a ET tube holder. Okay. Now we see that our ACLS meds are listed first and what time you gave them. Time, rhythm, time, rhythm, time, rhythm, initials. Okay? The medication nurse is giving them, but the recorder is recording what time and what the rhythm is. Okay? So this epinephrine can be given 3 times. If you need to give it more than 3 times, we would just come down here and write it. You also need to differentiate if you're giving an IV, endotracheal tube, or IO. For defibrillating biphasic, which we're going to use, what time, what the rhythm was, how many joules you used, and what the rhythm was afterwards. Then down here is some vital signs. You can go ahead and put those in. Six. Then what time the labs were drawn. Was there an Accu-Check? Was there ABGs? Did a Foley get put in? NGOT? Was there a chest x-ray? And any other kind of notes you'd like to write, you can put down here. Okay? And I'm going to make this into a PDF file, and you can have it, but you will have it for mock code. And I would ask that you guys use it so that you become familiar with it, and it's not so foreign.